My name is Jason Stankiewicz, and I'm currently a second-year Pulmonary and Critical Care Fellow at the University of Maryland. And I'm here today to discuss nicotine. Smoking is bad, but you all knew that. The point of this series is to take a deeper dive into nicotine use and treatment. As medical students, as providers, as physicians, as pulmonologists, I strongly believe that we need to know much more than smoking is bad for you, so stop. Oftentimes, the scenario will not be effective. We are in a unique situation to educate and intervene on those who use nicotine and really liberate them from the many harms that make this habit and addiction one of the leading preventable causes of death in the U.S. The purpose of this brief series is to slowly work on developing us as mini experts, an experience that we should have as practicing physicians, because I really think that this will elevate our training and help us intervene on those who experience nicotine as a burden on their health. These photos are an interesting segue into our topic of focus today, which is nicotine-containing products. We have seen an evolution of tobacco and nicotine delivery over the years, going from the au-naturel of rolling cigarettes to the almost space-age setting of electronic nicotine delivery systems. There's an evolution to these products, and I think it's important to know these and speak our patients' language. This is the brief roadmap for today's section. In brief, the goals of the section will be to 1. Review the history of tobacco and nicotine-containing products. 2. Review the composition of cigarettes, including the macroscopic and microscopic components. And 3. Review the composition of other nicotine-containing products. Where to start? What more logical place than with the tobacco plant? For those of you who couldn't get enough biology, botany, taxonomy, trivia, my terrible attempts at pronouncing Greek and/or Latin, the tobacco plant is within the family of Solanaceae. The two genuses include Nicotiana tabacum and Nicotiana rustica. Nicotine is present in the plant in varying quantities and is thought to be a naturally occurring insecticide. As a historical aside, the tobacco plant has really taken quite the journey from its origins to where we are today. Some important dates are listed on the slide. In the New World, in the Western Hemisphere, it was known that tobacco was used as an entheogen, or an agent used in ceremony, rituals, thought to be due to its psychoactive properties. Subsequently, in 1492, surrounding Columbus's journey to the New World, he delivered tobacco plant and seeds to the Old World. In the following years, Jean Nicot, the French ambassador in Portugal at the time, made tobacco available in France. Afterwards, a plant was named after him by Carolus Linnaeus. Additionally, along the way, we see the various uses of nicotine. In the 1700s, pipes and snuff were popular. In the 1800s, cigars and mustaches were popular. It really wasn't until the 1850s and 1900s that cigarettes, as we know them today, have become popularized, really after the Ottoman style in the Crimean War. Then, from 2006 roughly onwards, we have now seen a dramatic explosion in the use of nicotine in the form of electronic nicotine delivery systems. The anatomy of the cigarette. The bulk of our discussion will center around cigarette composition and design. Of all the products that we encounter today in our daily living, as we will see, the modern cigarette is a very highly efficient nicotine delivery system. And I don't say that in a good way, because an efficient delivery system in this sense means making our patients more vulnerable to addiction. For those not aware, just some basic terms to introduce. A pack of cigarettes traditionally includes 20 cigarettes, which we will discuss more on nicotine replacement therapy. More recently, the cost of a pack of cigarettes is important to know. For example, in 2017, in the U.S., the average cost of a pack of cigarettes ranged from $4.62 upwards to $10.67, and overall about 40% of this is accounted for by state and federal taxes. This image touches on the basic anatomy of a cigarette and includes the essential components: the filter, the tipping paper, the cigarette paper, and of course, the filler. The logical place to start is the filler, or the contents of the cigarette. We all know that the filler is going to include some type of tobacco. What I wanted to highlight is that there are different varieties of tobacco included, including different contents of sugar as well as nicotine. I more so wanted to highlight the additives, or those things in the filler besides tobacco. These include the humectants, which are components that hold together the otherwise easy to fall out tobacco from its container, including compounds like glycerol and propylene glycol. Other agents include preservatives and combustion modifiers that really allow for the designer of the cigarette to architect how long that cigarette's going to last and burn. Other compounds of note are other additives, including menthol. So menthol is an interesting compound because it's thought to be a flavor agent. So what it does, it's been designed to smooth out that harsh cigarette smoke. It decreases the irritative effects and decreases the irritated coughing effects. And as a result, it contributes to the power of addiction in certain populations of note. One, it's been described to have an impact on youths who smoke. And two, the majority of African Americans youths are described to smoke menthol-related cigarettes. Another key compound is ammonia. So ammonia is found in tobacco smoke, and what it does is it alters the pH such that nicotine is more readily available in its free base form, which is more readily absorbed. As a result, theoretically, there's more nicotine absorbed, making one much more prone to addiction. Here we see the various papers that hold together the content of a cigarette, the tipping paper, the cigarette paper. Traditionally, this paper is made from cellulose fibers, so hemp, wood, flax, each of which have pores, which allows the designer to modify the burn and how long the cigarette can last. Additionally, there are some adhesive molecules that enclose the cigarette. The filter is the component of the cigarette highlighted here. It's been designed as early as the 1950s as a means to lower smoke yields. It's usually composed of cellulose acetate, and it's designed to reduce the delivery of nicotine and tar materials to the smoker. If you look closely, occasionally there is also, about midway on the filter where the asterisk is, some air vents, and those are designed to entrain environmental air and as a result dilute the smoke inhaled. Sounds like a great idea and quite thoughtful. However, if we take a closer look in the bottom right image, we see that those vents are conveniently, or perhaps inconveniently, located for one to put their fingers, thereby negating the effects of the air vent. With the previous mentioned anatomy of the cigarette, it only follows to review the physiology, or rather how those burned components are delivered to the smoker's body. Notably, when a cigarette is burned, there's combustion of the aforementioned components. So that includes more mainstream smoke, as you see is the longitudinal aspect on the left of the screen, as well as a side stream smoke that bypasses the filter. Each of these types include different components of smoke, which we'll go into briefly. Contrary to my very basic understanding of smoke as a gas, strictly speaking, smoke is a collection of different phases, including the gaseous, the particulate or the solid phase, as well as an in-between semi-gaseous phase. Each of these phases of burnt product differ in terms of their composition of what's delivered to the patient. This is the gaseous phase. So the primary composition is really air and its components, including the listed gases above. There are other compounds, including formaldehyde, the 1,3-butadiene, acrolein, benzene, and hydrogen cyanide. Notably, several of these gases sound toxic, and for good reason, because they are toxic. And these are some of the important carcinogenic components of tobacco smoke. The particulate phase is that phase that includes the suspension of droplets as well as solid particles. This includes water, this includes nicotine, and this includes everything else, which is in the catch-all category of tar. Nicotine is a major psychoactive component to be discussed in other series, but what's of note is that up to 80 to 100% of nicotine that ends up in the lungs is absorbed. Now that's a tremendous bioavailability for these types of products. So everything else, the tar of the cigarettes, is important because there are many, many carcinogenic compounds, specifically metals, phytosterols, the polycyclic aromatic hydrocarbons or PAHs, as well as the tobacco-specific nitrosamines. Up to over 500 different individual PAHs exist in tobacco smoke. Moving forward, how do we know how much nicotine is in a cigarette? So there's a common thought that one cigarette contains about 1 milligram of nicotine passed along to the smoker. And that's true, and that's important for prescribing nicotine replacement therapy. However, there is an industrial standard by which we essentially measure how much nicotine is absorbed per cigarette by using a standard smoke machine. A smoke machine. Let that sink in for a little. So picture R2-D2 or C3PO smoking a pack of cigarettes. At least that's what I'm thinking. But generally the concept is that there's a defined volume of smoke, defined set of time, and a standard set of conditions listed by the manufacturers. What I wanted to show, at least by the graph by Jarvis and colleagues listed here, is really the variation in nicotine content found in smokers after smoking standard cigarettes. And we see that the saliva content of one of nicotine's metabolites is all over the board. As a result, compared to a robot, the individual, that patient in front of us, is going to regulate his or her behavior, including the volume, the pressure, the time of inhalation, exhalation, to match their nicotine needs or addiction. Beyond cigarettes, we should really be aware of electronic nicotine delivery systems, or ENDs. The basic schematics are depicted here, but generally it includes a mouthpiece, a button to activate a coil, as well as a tank filled with solution. That solution includes most of the things we mentioned before in addition to nicotine, and that nicotine concentration can range anywhere from 0 up to about 59 milligrams per milliliter. What we know is often folks who smoke ENDs will have similar, if not higher levels of nicotine than those of traditional smokers. Also, many END users do not know how much nicotine their device contains. Additionally, END users have high amounts of nicotine, metals, the TSNAs, similar to those of traditional cigarette users. And lastly, these users are more likely to lead to traditional cigarette smoke in a range of about 3.5-fold higher. This is a timely statement from the CDC in August of 2019. That really announced the first fatality of ARDS associated with vaping, and this was really a harbinger of many more case reports or case series to come. And I think my take home on this section is really that there are a lot of unknowns that we have about vaping and ENDs, but there are a lot of knowns and really harmful knowns, including things like this. So my conclusion is that we really need to ask our patients about vaping, and I would be very reluctant to recommend ENDs as a means for nicotine treatment. And we made it. So briefly, I just wanted to recap. So what we talked about today was a history of tobacco and nicotine-containing products, and the composition of those products as well. I think this really sets up a nice background for what's used in designing products that our patients take part in, and really what may help us better understand and how to intervene on that nicotine addiction. So overall, thank you all for taking the time to listen to this segment. I hope that this first part of our journey on nicotine use treatment has really just begun to scratch the surface and whet your appetite for more information. Coming soon, we'll be discussing on how that pesky nicotine compound travels from the nicotine-containing products to our patients, and the havoc that it wreaks when it gets there. Stay tuned, and thank you all again.